Hello everyone, welcome back again to Healthy Lifestyle platform where our health is number one. So today I want to demonstrate how to check pregnancy at home. How to check if you're pregnant at home, okay? In other words, how to do pregnant home pregnancy test. You can do it at home, you can as well do it in the hospital. I would like to tell you when you're supposed to do that and how to do that to get the right result because how you do that will determine if you're gonna get the right result or not. So follow me today, okay? If you're a young girl, this is very important to you. If you're an old lady, just a reminder, okay? So this is a we have so many pregnancy testing strip out there in the pharmacy. So you can get anyone, read the instruction well. All of them come with so many instructions, and particularly about the time you have to wait for you before you read your result, and then how to deep how deep you can immerse your strip. Okay, they all of them have guidelines and directions on how to use them. So I have here pregnancy testing kit and see they say 99%. Okay, it's over 99% accurate if you do it well. So you just have to get your urine sample. We know that whenever we do pregnancy test, we are actually looking for one thing, and that is HCG. That is human chorionic gonadotropin hormone. Chorionic gonadotropin hormone. That is what we are actually looking for. So whenever you go to hospital and the doctor asks you for urine sample, or sometimes they might even take your blood, they are actually testing for one thing, which is human chorionic gonadotropin hormone. So whenever you do it at home, you are actually looking for the same thing. So we have a testing strip that can easily detect if there is presence of human chorionic gonadotropin hormone in our urine and also in our blood. So today we'll be using a urine sample. Of course, it's my own. My urine sample is here with me. So I want to test using this testing strip to show you how you can do it at home to check if you are pregnant or not. Okay. Um, as I said, if you are pregnant, it will be positive. It will show double lines. Just look at the testing strip very well. If the result has two lines, it shows that you are pregnant. If it has just one, it shows that you're not pregnant, it's negative. Then you will have the maximum where you have to dip it. You don't need to dip all the strip in your urine. There is a maximum place you have to stop. Okay. So, but one thing I want you to know that it's not whenever you finish knacking, you go and do pregnancy test. See, we are testing for this particular hormone called human chorionic gonadotropin hormone, which is meant to be present once the placenta is present. So if your placenta has not been established, if placenta is not yet there in the womb, you won't see this hormone. So it's always very right to wait until you miss your period, or if you don't really have regular period, until about 10 to 12 days after knacking. Maybe you are suspecting that something might happen, you check it around 10 to 12 days after that suspected knacking, or you wait until you miss your period. Okay, so you can get the right result. Okay, because you might check it too early and it become negative. You think say you are not pregnant, but you might be pregnant, just that you checked it too early and the level of the hormone is not there in the urine. So you must wait to miss your period, or you must wait around 12 days after the knacking. Do you get it? So that is just the precaution. Having known that, let's just test this and see how. Okay, let's just test it and see what is going to happen. So first of all, open up your strip. You see the mark, there's mark here. So this is where you have to open it. Just apply a little pressure, it will open. You see it now? It's open already. So bring it out. We have my test here, the strip here. Look at the strip. Then in there, you have another thing there. There's another thing there. What is that? Yeah, this is not for you. This is just to preserve the strip. So throw it away, discard it. Boom. Okay, so this is what is important to us. If you look at here now, you can see where they say maximum. That means you just immerse this inside your urine. Never allow it to pass this line. Okay, some people will even allow everything to go inside, but always obey instruction. Okay, so allow it to just reach this maximum, and that is all. Then they say you should wait. Read the instruction. They say you should wait for 5. All right. You should wait for 5 minutes. 5 minutes. Read the instruction. So after testing, keep the strip out for 5 minutes. Wait for 5 minutes before you read your record. Okay, let's just do it now before 5 minutes will expire. So now open the Uline. Get your Uline with a good sample bottle that is not contaminated. Okay, then dip your strip. Make sure it doesn't pass that maximum. Then look at it, it's maximum already. So you stop, bring it out. Don't dip more than that, okay? Then wait for 5 minutes. Wait for 5 minutes. So in the meantime, while we are waiting for this test result to read, I want to let you know that sometimes people will say, is it okay to use early morning urine to test it, or can you use anytime urine? See, it's always advisable to use early morning urine because sometimes early morning urine is more concentrated, okay? Because you've not really drink any water, you've not drink any juice, you've not drink a lot of things during the day. The urine is more concentrated. So we assume that we're going to see more of that hormone in early morning urine, especially if you are just pregnant, if you are just maybe few days, let me say if you are just pregnant. But if you have already established that you're really pregnant, okay, you can use urine, any urine at any time, morning, afternoon, night, doesn't matter. But maybe you are checking for the very first time, 10 days, 12 days after knacking, or just missed your period. It's always advisable to use early morning urine so that the level of the hormone there might be enough. Okay? All right. Remember, you check it afterwards you missed your period, or 10 to 12 days after suspected knacking. All right, let's just read our test because sometimes by this time it must have read. So if you look very well, you can see the results. You can still wait for 5 minutes, okay? But look at this now. You can see that it's just one line. That shows that it's negative. The person that has this urine is negative. The person is not pregnant. Okay. So if you see double line there, you can see just one line that is showing. I don't know if you can see it, but it's just one line. If you see double line there, double red line, you have to go and register for your antenatal. You have to go and start buying baby things. Okay, madam, you are pregnant. All right. So this is just it. You can still wait furthermore for 5 minutes so that the line will become more visible, but obviously it's negative. You can see it's negative. So guys, this is how to do your pregnancy test at home. You can do it in the hospital where they can ask for either urine, or they might even ask for your blood. It's just the same thing. We look for the same hormone. It's just the same thing. Okay, thank you for watching, my friends. Share, 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 share. If you are pregnant, congratulations. Go and register for antenatal and start buying baby things. Thank you.